Good afternoon and welcome. I'm Megan Shebeck, Trustee and Grant Committee Chair at the DuPage Foundation. The grant opportunities we'll be talking about today are being offered through the DuPage Community Transformation Partnership, which is a collaborative endeavor between DuPage Foundation and DuPage County. We're very excited about these opportunities and look forward to all that we will accomplish together. Our information session today will be 30 minutes, with information provided followed by a question and answer period. Please provide your questions in the Q&A area. We will answer as many as possible. Frequently asked questions will be added to our website. Slides from our presentation today will be sent to you later today. Thank you for being here, and I'd like to introduce Mary Keating, DuPage County Director of Community Services.
Thank you, Megan. I'm really grateful to the County Board for voting to create this partnership with DuPage Foundation. As I'm sure you know by now, the board granted $10.6 million in American Rescue Plan Act funds to DuPage Foundation to administer this program. The goal of the program is to support social service organizations that are providing assistance to DuPage County residents in the areas of food insecurity, housing instability, mental health, and substance use disorder. We've put together a committee made up of Foundation and County board members, Foundation and County staff, and a community member. And together we have crafted this program. And we're very excited to finally launch it. So this is an exciting opportunity, and there's been a great deal of publicity about the partnership between the foundation and the county, which has already generated many questions. So our purpose today is to provide details about the grant program and answer those questions. So now I'd like to introduce Barb Stepaniak, Vice President for Programs for DuPage Foundation.
Thank you, Mary. I'm thrilled that we have this opportunity to use these funds to support those who have been impacted by the pandemic and to reimagine the delivery of services for DuPage residents. Throughout the pandemic, we've observed a significant increase in food insecurity, housing instability, mental health, and substance use disorder. So this grant program will be focused specifically on those issues. And with that said, we know that there are many organizations that are doing great work, and there are many in need of funding to support that work. However, we will be laser focused on these 4 issues. And unfortunately, that does mean that we will not be able to fund every type of organization. So I'm going to start talking about the eligibility. Organizations that are eligible for this grant program are 501c3 social service agencies in which more than 50% of individuals served are DuPage County residents. If your organization serves a larger area, you are eligible if you have a facility in DuPage County from which you deliver services. For example, some of the agencies serve the entire Chicagoland area, but they have an established center right here in DuPage. If you don't primarily serve DuPage and don't have a center here, you may still be eligible if you have an advisory board that is specifically focused on programs geared toward the needs of DuPage residents. However, in that case, you'll need to show evidence that the advisory board has been operational for a while. And regardless of the criteria that makes your organization eligible, all applicants will need to show a direct connection to one of the issue areas. Through the DuPage Community Transformational Partnership Grant Program, I know that's a mouthful, but it definitely is a partnership, and we want to emphasize that. We will be offering 2 separate application processes, one to support immediate needs and one focused on transformational programs that are designed to have long-term impact. And I want to emphasize again that for both of the processes, we will be funding programs that are focused on eliminating food insecurity, promoting housing stability, and providing effective mental health and substance use disorder prevention or treatment programs. We're also hearing about a lot of other grant opportunities emerging to address some of these issues. So we will be monitoring funding that becomes available to our community from other sources to ensure that we're not duplicating funding and to be collaborative when possible. We also realize that the needs in each of these areas will evolve over the next 5 years, and we intend to remain flexible to address the needs and fill gaps as best we can. So I'm going to start by talking about the first grant opportunity. It's the Immediate Intervention Grant. The immediate intervention grants are intended to provide financial resources so that organizations can respond to immediate needs of their clients or to help an organization increase their capacity to deliver efficient services and resources. Some of the ideas that come to mind are the purchase of food, emergency financial assistance, rental assistance, or the provision of mental health care for low-income clients. And I'm sure you can think of others. And I kind of see these grants as being very similar to those that were awarded through our COVID response fund when immediate relief resources were distributed. These grants will be awarded annually for the next 4 years, this year, 2023, 2024, and 2025. And we'll be modifying the guidelines each year based on the needs in the community, and organizations will have the opportunity to apply for a new grant each year. The minimum amount that organizations can apply for through immediate intervention grant program is $20,000, and there's not a maximum. While we aren't providing a limit on the amount organizations can apply for, we do expect applicants to be realistic about their capacity to manage the size of the grant they're requesting. So for example, the requested amount should not expand your annual operating budget by 50%. That's just an example. The appropriate amount will be dependent on the size of your organization, the scope of the need, and the number of residents that will be served. The application process will begin with a letter of intent that will be due April 15th. Our evaluation team will review the LOIs that we receive and will advise applicants via email the status of their request in late April. And at that time, selected organizations will be invited to submit a full proposal, providing the team with more detailed information. Right now, we really don't know how many LOIs we'll be receiving, but we do anticipate that we will not be able to invite everyone to complete a full application. The actual applications will be due by May 27th, and grants will be awarded in late June. The foundation will be reporting annually to the county board on the impact of these grants, and the county in turn must report to the U.S. Treasury. So grant recipients will be required to keep track of and submit specific impact metrics regarding the populations and numbers served in a final report. And now I'd like to talk about our second grant opportunity, which is the Transformational Grant Program. So through the Transformational Grant Program, we're interested in supporting evidence-based programs that are focused on long-term solutions to address food insecurity, housing instability, mental health, and substance use disorder. And examples of this might be to expand or scale current programs, or to implement a software that will change and improve the way a service is delivered. Again, as organizations working directly with clients, you likely have many other ideas to transform the delivery of services. We plan to offer additional information sessions in April to further discuss the transformational grant opportunity, but we wanted to give you a general idea of the scope of the program because we know you'll need time for your board and staff to strategize how your organization can advance your work in one of these areas. To help you start thinking about this, organizations will be eligible to apply for a 1-year or 2-year grant program, and we plan to offer a second round of funding in 2024. This process will also begin with the submission of an LOI, which will be due June 3rd. And just like the immediate intervention grants, the evaluation team, excuse me, will review the LOIs and will invite organizations with the most promising proposals to submit a full application. And that application will be due September 15th, with grants being awarded in October. Again, there will be no minimum or maximum request amount for this grant opportunity. The appropriate amount to apply for is related to the size of your organization, the scope of the need, outcomes you will be measuring, the long-term impact you intend to have, and the number of residents that will be impacted. The guidelines for this grant program, well, actually for all of the both grant programs, will be posted on our website tomorrow, along with the immediate intervention LOI application. We also will email the guidelines to everyone who attended today's session. All LOIs and applications will be submitted through the DuPage Foundation portal, which is listed on our website. If you have applied to the foundation before, you should use that account for LOI and application submission. If you have not applied, you will need to create an account when you initially go to the site. The immediate intervention and transformational grant opportunities are separate processes, and organizations may request a grant through one or both grant process. As always, we encourage you to allow ample time to get your LOIs and applications submitted by the 5 o'clock deadline on the specified due dates. The foundation is very strict with our deadlines, and we will not accept any late applications. In the past, we've had applications submitted just minutes after 5 o'clock, and we didn't consider them. And that's really hard when people have put a lot of time and effort into an application. Some of the questions the evaluation team will be considering when assessing grant LOIs and applications include, is the community need relative to the request clearly described? Is there a description of the program, evidence of the strategy's effectiveness, and indication as to how outcomes will be measured? Has the population that will be served been negatively impacted by the pandemic? And will resources and services be deployed in an equitable manner? Has the organization demonstrated that they have the capability to provide detailed reporting on the use of the grant? Does the organization have experience providing programs in one of these issue areas? Is the organization financially sound? The funds for these, as I mentioned earlier, the funds for these grants were initiated by the federal government. So we will be reporting back to the county, and they subsequently must report to the US Treasury. And as a result, we need to collect more financials than we usually do. And we understand that this means that some organizations may not have all the financials we are requesting. And unfortunately, without that information, they may not be eligible to apply. Finally, there will be additional factors that will be considered depending on the specific area of the grant request.